The flu is a highly contagious respiratory illness. It turns up year after year with devastating consequences. It all caused by a most elusive virus.
The word for health is paramount. Influenza poses a significant threat to communities globally. Today, we're here to talk about something affects millions of people every year. Influenza. But first, what is influenza?
Influenza, commonly known as the flu, is a contagious respiratory illness caused by influenza viruses. It can lead to mild to severe illness and symptoms.
There are around 1 billion cases of influenza, including 3 to 5 million severe illness. It causes 290,000 to 650,000 respiratory deaths annually.
99% of them in children under 5 years of age with influenza-related lower respiratory tract infection are in developing countries.
One of the deadliest flu pandemics was caused one such virus. Between 1918 and 1919, the Spanish flu infected a third of the global population and killed up to 50 million people worldwide. Called H1N1, this particular strain of virus likely came from birds.
Symptoms begin 2 to 4 days after infection and usually last around a week.
Symptoms of influenza: fever, fatigue, cough, headache, and sore throat.
People recover from fever and other symptoms. This is a week without requiring medical attention. However, influenza can cause severe illness or death, especially at people at high risk.
Vaccination against influenza is our first line to defense. Not only protects individuals from severe illness, but also contributes to the broader community immunity, shielding those who are more vulnerable.
Other ways to prevent influenza: avoid close contact. Stay away from sick individuals. And if you're sick, limit contact with others. Avoid touching your eyes, mouth, or nose. Avoiding touching your eyes, mouth, or nose with unwashed hands is crucial for preventing the spread of influenza and other viruses. Cover your mouth and nose. Use a tissue or your elbow when coughing or sneezing. Dispose of tissues properly.
Stay home when you are sick. If you have a flu-like symptoms, stay home until you are fever-free for at least 24 hours without the use of fever-reducing medications.
There are 4 main types of influenza viruses: A, B, C, and D. Influenza A and B are the most common and cause seasonal flu outbreaks in humans. Usually causes non-respiratory symptoms. As influenza primarily affects the seasonal flu typically targets the specific strains of influenza A and B viruses, as these are the main contributors to human influenza outbreaks.
Let us not underestimate the power of prevention. Imagine a world where influenza doesn't disrupt our lives, where families don't endure the pain of losing someone to a preventable illness.
I urge each one of you to prioritize your health and the well-being of our community. Let's make influenza prevention a shared responsibility.
Defend and conclude. Against influenza!